Hi, everybody, and welcome back to the Prokinetic Motility MMC, part of my channel, the playlist, if you will. Let's get into it with another kind of back to basics one, but it's important. What the heck is a prokinetic? What is this lady talking about with all of these prokinetic motility MMC videos? So let's rewind and make sure that we're all on the same page because I think there's some misleading or contradictory stuff out there that I want to clarify. So first off, I pulled up a couple of definitions that I thought would be useful. And I'm going to bore you for just a moment by actually reading to you, but bear with me because it'll help kind of flesh out the meat of this video. So first off, I went to everybody's favorite source of information, Wikipedia. And according to Wikipedia, a prokinetic agent is a type of drug that enhances gastrointestinal motility by increasing the frequency or strength of contractions, but without disrupting their rhythm. Now, I have two issues with that statement. And we know Wikipedia is not perfect, but let's just critique that. A, saying that it's a type of drug is not accurate. There are plenty of herbal medicines, natural compounds, and even probiotics that are prokinetic. They promote motility, they promote movement. So I do think that we're putting this in too tight of a box by saying that it's a type of drug. But initially, that is where this definition was. So that I have an issue with. Secondly, the bit about without disrupting the rhythm, I don't know if I totally buy that. I think there probably is some alteration in rhythm too, but this is still an area where I think we have a lot more to learn. But for what it's worth, I would say there's two holes in the Wikipedia, one sentence definition. Now, moving on. I found an article titled Prokinetics in the Management of Functional Gastrointestinal Disorders. It's a 2015 article. I will link to it in the doobly-doo below. And in the intro, there was a sentence or two that I just thought was useful. And they say, the term prokinetic means simply to promote movement, and in the context of the gastrointestinal tract was introduced to refer to a class of drugs that promoted gastrointestinal motility and thereby transit. This stimulatory effect was considered clinically relevant for the management of disorders characterized by impaired motility, such as GERD, gastroparesis, intestinal pseudoobstruction, and colonic inertia. However, as the complexity of symptom pathogenesis came to be understood, and as the multifactorial nature of the more functional gastrointestinal disorders came to light, such a simplistic concept, parentheses, stimulating motor activity, end parentheses, began to appear inadequate to address the contributions to symptoms of such factors as dysmotility, visceral hypersensitivity, and altered visceral tone, as well as changes in compliance and accommodation. So what all that is getting at, minus all the jargon, is they're saying, hey, this is where we started. This term prokinetic was originally used to describe a type of drug, and we thought that it only did this. And now we're seeing that there's a lot of variables, there's a lot of complexity to the system, and maybe there's more to it than that. So I thought that was actually a really useful way to start the conversation. And they even just said right in the beginning that the term was introduced to refer to a class of drugs. I think that's reasonable. I think that now we have progressed. In 2019, we know that herbal medicines, we know that probiotics can take on a prokinetic action and therefore can be classified as a prokinetic. So I don't think limiting it to drugs right now really makes a lot of sense, but I think that this is a useful framework to go off of. And then finally, to segue off of that, the Gastroparesis and Dysmotilities Association, which is digestiveddistress.com, has a nice reference page for if you are considering doing a prescription prokinetic. This page actually was a nice concise list talking about the different types, what they do, and like a little bit about how they work. So I will link that in the doobly-doo below too. But let's cover a couple of things because I will say there's one issue I had from that 2015 article, and here's what it was. Let's see. Okay. It was introduced to refer to a class of drugs that promoted gastrointestinal motility and thereby transit. That does imply that prokinetics would be more useful in a condition where you want to promote transit or ease constipation. You want it to take less time for your food to get from mouth to anus. And they're inferring that without overtly saying it. And that is a misconception I see. I've had patients ask me that. But what I would say I have noticed clinically is I have given prokinetics, and again, I've had people try a bunch of them. I've had people with diarrhea, dominant, IBS or SIBO, constipation dominant, IBS or SIBO, and mixed cases all respond positively to prokinetics. So in my eyes, at least the herbal prokinetics don't necessarily stimulate motility and transit in the context of like easing constipation. I think it has more of a modulating, normalizing, almost like adaptogenic effect. And that's important because it means that it does open the door for us to really try this system and really try to like understand it and flesh it out better, because it's not necessarily going to stimulate you too much or push you too hard in one direction or another. Now, the drugs do tend to be stronger. So drugs, of course, have more of a likelihood of side effects or more likelihood of overzealous effects. So not a side effect per se. If you have constipation and then a drug gives you diarrhea, it just treated your constipation super well. So that is going to be a little bit more prevalent with the drugs, just because it's like you're playing whack-a-mole, and instead of the little, felt hammer they give you, they're using a sledgehammer. The sledgehammer is the prescription medication. The little felt hammer is the herbs, in my opinion, and the probiotics. So I would say that really it's a pretty low risk endeavor to try prokinetics and see if they have a normalizing effect on your bowel movements, your bloating, your GERD, whatever it might be. Now, also related to that topic, which is, have I, as a clinician, had people take prescription prokinetics? And I would tell you that not really. I have found that the herbal prokinetics and probiotic prokinetics do a good enough job, and we're treating all the root causes and doing all the other stuff with SIBO that we're supposed to, that I haven't found the need to refer out for this hardly at all. I did just bring it up with a patient more recently, but it was less because of SIBO and more because of some recent complications with her case. So she may pursue a prokinetic, but it's not because it's been a really difficult case of SIBO and we can't get rid of the SIBO. It's more unrelated. And in the name of HIPAA, I probably shouldn't say more than that. But I've had another couple of people who we brought this up, and usually I will say, hey, this is on my radar. It's something that we should probably talk about soon if we don't see significant benefit. Like I remember one lady, I said, look, I think we should do the HCL challenge, which I could do another video about down the road. I think we should do the HCL challenge. And then if that doesn't make a notable difference, another consideration is a prescription prokinetic. And I'll tell you what, for her, the HCL challenge and getting on betaine HCL was so therapeutic, she ended up not needing the prescription prokinetic. So I've had a couple of conversations like that, but I don't think I've actually had anybody take me up on like getting that referral and getting that going with gastroenterology. So all of this is to say, to wrap up, herbal and probiotic prokinetics are actually, I think, very effective and very normalizing and nutritive and very low risk as far as trying a bunch of them and seeing how you do. There are drug prokinetics. I haven't felt the need to rely on them a lot as a clinician, thankfully, because then I'm not a prescription person. I'm not a prescriber. So that would necessitate a referral out, and it's a whole shtick. So thankfully, I haven't had to do that hardly ever, because the natural compounds seem to work just as well. But if anybody asks you, if this comes up at like a party down the road, because you're that kind of a weird person, if somebody asks you, well, gosh, what is a prokinetic? You could just tell them that it is a thing that promotes movement, or a thing that promotes motility. And you can leave it at that, because there are drugs, herbal medicines, supplements, and probiotics, and probably other stuff too, that have a prokinetic effect. And for that, actually, too, I will add, I would bet you anything, if we had the funding to study it, I think meditation probably also is a prokinetic. And exercise, for that matter. We know exercise has prokinetic pro-motility effects. So I would say the loose definition is a prokinetic is a thing that promotes movement and promotes motility. I hope that this was an absolutely exciting and riveting video, as always, I'm sure, listening to me talk about gut stuff. Have a wonderful rest of your day, and I will see you in the next video.